Today in part 1 from the ED&C, we're going to examine 4 Depo-Medrol documents. 2 data sheets for the drug, one from the USA, the other from the United Kingdom. A Dear Doctor letter that most, if not all, never saw. And the neurotoxicity results for a major component of single-dose Depo-Medrol. We'll examine these mixed messages from Pharmacia, Upjohn, Pfizer, and how this steroid's epidural popularity was built on contradictions. This is where it all began, back in the 1950s at the Upjohn plant in Kalamazoo, Michigan. After rigorous testing, the only approved uses for Depo-Medrol by the U.S. Food and Drug Administration were intramuscular, intra-articular, and intralesional injection. But doctors weren't satisfied with just 3 uses, and over time, as the company switched hands from Upjohn to Pharmacia and then Pfizer, the steroid began to be injected off-label into places not approved by the FDA nor safety tested by the manufacturer. Among these were intrathecal injections inside the spinal cord, periocular and subconjunctival injections of the eye, as well as epidural injections within millimeters of the spinal cord. As a result, hundreds of serious adverse events started pouring into the FDA's MedWatch alert system every year, with reports of blindness, paralysis, nerve destruction, exacerbation of pain, arachnoiditis, and even death. With both sides of the controversy weighing in, the FDA's slow reaction was mixed as the off-label safety and efficacy record was evaluated. It literally took decades and the persistence of dedicated doctors to force Upjohn and the FDA to make changes to Depo-Medrol's data sheet. As a result of their efforts, Depo-Medrol was finally contraindicated or banned from intrathecal injection inside the spinal cord due to reports of severe injury and death, and although not printed on the label, the warnings were now plainly listed in the data sheet. Wait a minute. It appears that the severe adverse reactions that ban Depo-Medrol for intrathecal use are identical for epidural use. Yet epidurals haven't been banned, nor is there any reference for this use anywhere in the entire data sheet. But on the other side of the Atlantic in the United Kingdom, Pharmacia Pfizer were also running into trouble with the off-label epidural administration of Depo-Medrol. And although the listed contraindications in their data sheet are the same as ours, they do address epidural use. It's interesting to note that independent animal tests conducted in Israel confirmed the neurotoxicity of myristyl gamma-pictolinium chloride, a major component of Depo-Medrol. This complex alcohol literally destroyed the receptive nerve layers of the eye called the retina, and yet doctors continue to inject it around the nerve roots of your spinal cord without concern. A few thousand miles further south lies another continent at odds with itself over Depo-Medrol. Following a massive media blitz describing serious but familiar adverse events, Australia's National Health and Medical Research Council tragically commissioned a study in 1994 defending the unlicensed use of Depo-Medrol. The study accused those who dared to question the efficacy of this treatment as an unjustifiable assault on their profession, giving insult to injury to the maimed and suffering. But in less than 6 short years, the council mysteriously rescinded the study and all its findings without explanation. Despite its injury and poor efficacy record, it's clear that this controversial steroid remains resistant to global scrutiny. And to this day, the off-label epidural administration of Depo-Medrol, its primary use by doctors, is not even listed nor addressed in the U.S. data sheet. Only when curious doctors contact Pharmacia Pfizer for further information will the manufacturer voluntarily warn them in a Dear Doctor letter that it isn't recommended due to serious injuries and other adverse events. Is $300 billion a good enough reason?